Have you ever wondered how complex medical procedures like PICC line placements are coded? A PICC, or Peripherally Inserted Central Catheter, plays a vital role in patient care. It's a long, flexible catheter inserted through a vein in the arm, reaching the central vein, usually the superior vena cava. PICC lines are essential for various treatments, such as long-term IV antibiotics, chemotherapy, and total parenteral nutrition. They are frequently used when traditional venous access is challenging. Now let's dive into coding for PICC lines. First, know that CPT codes depend on specific factors. These include patient age, imaging guidance, and the type of service provided, like insertion or replacement. For example, common CPT codes include 36568 for insertion, without imaging for patients under 5 years old, and 36572 when imaging guidance is used. If imaging is documented, don't code it separately. It's included in the 36572 code. Accurate documentation is key. Make sure to note the insertion site and catheter tip location, whether imaging guidance was used, and why the PICC was placed. If imaging is not clearly stated, default to non-imaging codes. When it comes to imaging guidance, codes 76937 and 77001 for ultrasound and fluoroscopic guidance, respectively, are not to be reported separately. Remember, these services are bundled within CPT guidelines. Next, let's discuss removal and replacement. For simple removals, no specific CPT code exists, as it's usually included in evaluation and management services. If a new PCC is placed, report it as a new insertion. For diagnosis coding, reflect medical necessity. Common categories include infections, cancer for chemotherapy, and nutritional deficiencies. Always code the underlying condition first before adding device-related codes. Don't forget about HCPCS Level 2 coding for supplies, which can be payer-specific. Examples of relevant codes are a 4223 for infusion supplies and a 4221 for catheter maintenance supplies. Be wary of modifier misuse, as many PICC services are bundled. For CPC exam preparation, understanding what's included in codes like 36572 is vital. Read the entire operative note, confirming central placement and imaging usage. Prevailing coding mistakes often arise from misunderstanding bundling or incorrectly coding imaging. To effectively code PICC procedures, follow a consistent workflow. Identify the procedure, confirm patient age, check for imaging guidance, and assign the correct CPT code. Review the diagnosis and required supplies. In conclusion, coding for PICC lines may seem straightforward, but attention to detail is crucial. Master bundling rules and documentation, and be proactive in learning these aspects, and you will excel in the coding world.